Persistent System is a technology services company focused on helping the customers, specifically in the health and life sciences ecosystem. Within the healthcare, we work with most of the payers and providers. We essentially help them solve some of the pressing problems, whether it is the cost of care, whether it is helping them improve the outcomes or improve the quality of care. And we are a technology services company, and we do that through the use of technology, whether it is helping them build the digital solutions or use data and analytics, cloud, security, which is a key aspect as we speak because of the security incidents that we see, as well as automation and integration, specifically on the interoperability. Whenever there is a change at the policy and regulation level, you could see the impact of those changes at the systems level as well. When I say systems, I'm specifically talking at the technology level, right? And specifically, if you look at the healthcare industry as a whole, it's inundated with significant amount of legacy systems, which are very monolithic in nature, which makes things really worse. The key thing is to have a well-documented, modular, interoperable system, that is built on modern architecture is going to be extremely important. If you look at some of the examples, COVID is a very great example, right? Virtual health was the need of the hour, and technology played a very important and crucial role in terms of moving the needle. I think the pre-pandemic levels were around 5% or so in terms of the virtual health. I think today it's at around 25%, right? So in my view, I think it's extremely important to use technology to the extent possible, to look at the changes so that the health plans could be at the forefront. Absolutely. So Gen AI and AI, I think it's just the start, right? We see multiple usages for that. Of course, there has to be, proper usage and control mechanism has to be in place. But the underlying thing is, you need to have the right data sources available, and the quality of data is going to be very, very important. But having said that, once you have all the foundational elements in place, I think the way we see it, we see Gen AI specifically helping the healthcare industry in three different vectors or axes, right? The first one is what I call as the productivity and efficiency vector, right? Where it could definitely help the clinicians, nurses, and many others in terms of doing their jobs better, improve their productivity and efficiency, right? That's number one. The second thing is the experience itself. Whenever a member or a patient calls a call center, how do you personalize the information, right? As an example, if I'm calling the call center and then would love to have the information that is customized and able to address that within a short period of time, right? So that also could play a very, very critical role in terms of improving the experience, not only for the members as well as the patient, but also for the clinicians themselves, right? As well as, in today's world, whenever you have to call the call center, the typical call ranges anywhere between 9-10 minutes, right? It can also be useful to move the mode of conversation itself into a conversational AI, where it provides the ability for the members and patients to interact and get the answers that they wanted. And the third thing, which is yet to be seen, is there is a lot of application on the clinical side, as well as it can also become a potential growth vector for healthcare companies, which is going to take some more time. Healthcare is very complex, right? But it doesn't have to be that way for the members. And in my view, since as a consumer as well as a provider of technology services, my request would be to maximize the technology to make it as simple as possible for the members, right? And be it alternative care models, whether it is virtual health, or whether it is, health at home, right? Use technology to the extent that's possible so that it's simple, right? I think the trust and transparency is the key. Two or three things, right, at the highest level. The first and foremost thing is, trust and transparency has to be, there between all the parties, whether it is patients, whether it is payers and providers, right? And the second thing is change management is going to be very, very important, right? Again, for all the three parties in terms of why they are moving from fee-for-service to, outcome-based models, and what is in it for them and why they are doing it, right? Those are the two things that are going to be the foundational elements. But then the third thing is specifically for the health plan to be successful, I believe there are 4 or 5 things that are critical, right? The first one is they should have the ability and technology to, access the data and, collect the data from multiple sources, whether it is claims, whether it is clinical data, whether it is social determinants of health and so on and so forth. That's the number one. The second thing is they should also have the ability to identify and stratify the population, right? That's the second thing. The third thing is using the data that they have collected so far for clinical, operational, and financial intervention definitely is going to be a key thing. The fourth thing is wherever it's possible, look at ways to standardize care. Finally, how do you scale all these things across all the population with still having the ability to retain the personalization that is needed for each of the patients, right? In my view, I think these are some of the key elements that is needed for the health plans to be successful in the future. There are a few things that we have done along with our customers, right? I think some of the foundational elements is investing in a solution which is a member 360-degree solution is going to be key, right? Which has the ability to collect data from multiple sources, whether it is claims, clinical. In today's world, members also have a lot of wearable data as well, right? And then social determinants of health, that's number one. The second thing is, again, investing in call center technology, which has the ability to get real-time analytics, right? That's another thing. And then we briefly spoke about GenAI. It's in the initial stages that there could be, investment that could be made, a lot of proof of technologies that could be done in terms of, how do you use the data that you already have about your members in terms of personalizing, the needs of the members, right? So those are some of the things that we work with our customers in helping them.